So let me go ahead then and introduce our next speaker. Tyler, I'll let you come up while I'm introducing our next speaker. Our next speaker is Commissioner of the Oklahoma Department of Mental Health and Substance Abuse Services, Carrie Slatton-Hodges. She's an American licensed professional counselor in Oklahoma. She was interim director. She's been interim director since January of 2020. Appointed by Governor Stitt. Before that, she served 12 years as a deputy commissioner for the same entity, overseeing treatment recovery services throughout state-operated and contracted treatment programs. She has her degree from Oklahoma, from Southern Nazarene in Oklahoma, also a master's from Southwestern Oklahoma State, and she is very interested in the delivery of treatment services throughout innovative programs, including mobile care, telehealth services, and I think we have located her speech, so her slides. So I will go ahead and turn this over to Commissioner Slatton-Hodges.
Good morning. I'm super happy to be here, and I'm also really pleased to be among friends, Judge Kat Burton and Dr. Britta Ostermeyer. So it's really wonderful to be in such great company. I am not a judge. I am a mental health professional, and I was asked to speak a little bit about children in Oklahoma, and I'm going to give you a lot of facts and figures as I talk about children, but there are some key points that I want you to take away from this. In particular, I want you to think about that all of us, whether it's adults or children, experience a combination of risk factors and protective factors. That is basically the science of prevention. And some of the things that I'll be talking about are risk factors and the outcomes that happen in our state when children experience events or situations that might have a negative impact on them. But what I really want you to keep in mind also is that protective factors truly help mitigate the effects of those risks. And so I want us to keep that in mind as we move forward here. Also want to comment on, I could have come up and just done a conversation about the introduction, but that wasn't my topic today. But what I did want to say is when we look at statistics around mental illness and addiction in Oklahoma, they're actually quite similar to physical health statistics in Oklahoma. And so it would be really odd for us to have really great mental health in Oklahoma when we know that we across the board have pretty poor physical health in Oklahoma. So when our first speaker mentioned that those two are so integrated, and that when we experience things that may result in a negative experience, that happens on both the physical and the mental health side. And when we are promoting things that have a positive experience, again, that has the effect on both the physical and the mental health side. So you can't really think about or look at those in isolation. So I'm going to give you some statistics today, really having to do with youth in Oklahoma and kind of where we're at today. And we're going to look at some of the impacts of stress and adverse childhood experiences. All of you know what adverse childhood experiences are. There's a lot of study around that by Kaiser Permanente, who looked at when you experience something in your youth that could be considered traumatic, that can follow you throughout your life. And it correlates with negative outcomes in your life, both on the physical care side, as well as the mental health and addiction side. So we know, for example, if you have high ACE scores, you're much more likely to experience debilitating mental illness and or have an addiction to substances when you grow up. And that can follow you throughout your life. But what we do know is that layering in protective factors can make a big difference in that. And I will tell you in particular, when we talk about mental health in Oklahoma, we are, at least the last time I looked, we are second in the nation for children who have 4 or more adverse childhood experiences. We are second in the nation for children who have 4 or more adverse childhood experiences. So again, it would be odd to think we should be mentally healthy when on the social side and the experiences that we're having, there is a lot of stuff happening to Oklahomans. There's physical disasters. There's high incarceration rates. There is growing up with an incarcerated parent, having mental health addiction or chronic physical disease in your family. Those are all things that affect us throughout our life. So what I want to do is give you a little bit of information. We do what is called the Oklahoma Prevention Needs Assessment every other year. And in the past, the needs assessment was a voluntary survey that happened among youth across our school systems. And it really looked to find out what was going on with youth in Oklahoma. A couple of years ago, our legislature voted and put across a bill that it would become mandatory in Oklahoma. So we're just starting on the tip of the iceberg to get a much broader picture of what's happening with youth in Oklahoma. Before, we've had pockets of information around youth in Oklahoma. What we do with that information, by the way, is we give it back to school districts to say, here's the risk factors, here are the issues in your school, and here's the protective factors in your school. And we give that back to them with a plan of how they can lower those risk factors and how they can elevate their protective factors so that that particular school system can start to move forward in ways that have a positive outcome on the youth. Now, as I said before, this was voluntary. And so you would see active school systems really take that to heart and work around that. And then you see school systems that say, I don't really want to know. I don't want to know what's going on from a negative perspective within my school system. But now that it's become mandatory, all schools will receive the information, have the opportunity to work with that information if they so choose to implement a plan around that information. But it will give us as a state even better data to work with and understand what is happening with our youth. So there are a number of evidence-based things to put in place in school systems and with children that there's a lot of research around that we know has positive outcomes. One is called multi-tiered systems of supports. And we actually are participating or working with 250 schools around our state on multi-tiered systems of supports. And what that does is it works with the entire school population, from a prevention aspect to a kids that are experiencing symptoms to the most in need children within that school system. And it layers in things for all of those kids. What we do know is that there are many types of things that you can implement in a school system that greatly affect the outcome of those youth long term. Things such as the PACS Good Behavior game. It's a classroom management style that is evidence-based that helps kids learn to regulate their own emotions and their own behaviors. And there's a lot of longitudinal study around this that shows when those youth become adults, they are much less likely to abuse or become addicted to substances, much less likely to find themselves in a situation with a serious mental health need, and much less likely to become involved with the criminal justice system. So these are some of the types of things that we layer in those multi-tiered systems of support. We also do BIS, which is behavioral interventions in schools, where we have a person that can work one-on-one with a child or multiple children as needed to help them succeed in school. And when I say this, it's really from a behavioral aspect. A kid who is having a difficult time managing being in a classroom setting, managing their own behavior. This is almost a coach that works with them to help them regulate their behavior in schools. We also, last year was passed House Bill 4106 that requires all school systems in Oklahoma to have an MOU with their local safety net provider about what will happen when they have a child that is in crisis, who they will call, what that response will look like, and have this plan and MOU in place prior to crises happening so that everybody knows exactly what's going to happen when there is a crisis. So I talked a bit about the OPNA, the Oklahoma Prevention Needs Assessment. It is a survey that is 6th, 8th, 10th, and 12th graders. It is an anonymous survey on behalf of students, and then we're able to acquire that data and get a good snapshot of what is happening with kids in Oklahoma. It asks things around alcohol, tobacco, and other drug use, the sources of alcohol and prescription drugs. It asks questions about students' mental health and suicide, antisocial behaviors, and then identifying the risk and protective factors of the youth in our state. And when we talk about risk and protective factors, I want you to know that every one of us can be a protective factor. And in fact, not only can we, it's incredibly important that we are. You've seen lots of research and studies around how one person can make a difference, and it really is true. If you are someone that a child or a youth can talk to and be objective, or assist them with pro-social activities, where that's going on a fishing trip or shooting hoops in the neighborhood or any of those types of things, helps a youth be proactively attached and supported by their community. And it actually has an effect, not only in that moment, but lifelong. So we're going to look at some of what has come out of these surveys. Some key highlights is that past 30-day marijuana use is increasing in Oklahoma. And again, this is 6th, 8th, 10th, and 12th. A lifetime and past 30-day alcohol use and binge drinking is actually decreasing among 12th graders. But overall, in Oklahoma, our rates of alcohol use among youth is higher than the rest of the United States. There is a decrease in perception that high or moderate use, or the risk of that use of smoking marijuana, there's a decrease in the perception that that is problematic. And what we know, and what we talked about prior to the passage of marijuana laws in Oklahoma, is that when people see something as less risky, more socially acceptable, they are much more likely to use and or try that, in particular with youth. So we knew ahead of the laws going into effect in Oklahoma, the science told us that use of marijuana in our state among youth would increase. And sure enough, the data is showing us that that is the case. We are continuing to see decreases in cigarette smoking, which is fantastic. Smokeless tobacco in Oklahoma, though, has remained relatively stable. More than half the students in each grade surveyed had moderate or high psychological distress in the past 30 days. And among all 4 grades combined, 1 in 6 seriously considered attempting suicide in the past 12 months. And about 1 in 10 reported attempting suicide in the past 12 months. Now, I want to tell you something, because the Montana Institute, if you're not aware of them, you should look them up. They have done a lot of work around perceptions and how that affects behavior. And when we talk about statistics like this, and you hear that 1 in 6 considered attempting suicide and 1 in 10 reported attempting suicide, those are really scary statistics. and they're actually quite negative statistics. However, if you look at the flip side of that, that means 9 out of 10 students did not have an attempt of suicide during the past 12 months. And that's a big deal too. And we need to understand that we have a lot of healthy youth in Oklahoma. And we need to understand, how did they get there? Who is helping these youth be supported, be connected to their schools, have plans for their future, because that is what is having a difference. I also want to just tell you as a note, does anyone in here know the #1 means of death by suicide for youth in Oklahoma? No? No? Good. Guns. The #1 way that children in Oklahoma die by suicide is the use of a gun. And you think, well, how can that be? Because children can't acquire guns, right? So obviously, as a state, we have a lot of work to do around of guns getting in the hands of youth. We had a decrease in high risk in 2011 and 2012, but we also had a decrease in high protection. And we have an increase in low commitment to school scale by about 10 percentage points since 2011 and 2012 among all 4 grades combined. And I'll tell you why this is so incredibly important, is that commitment to school scale is one of the most powerful protective factors that a youth can have. If they feel connected to their school, involved in their school, it is a huge protective factor. So I'm going to just show you some of these statistics on charts, because a lot of people like statistics, right? So here we are. So you can see substances. The #1 substances that is reported used in the last 30 days is alcohol. And second is marijuana. But you can also see the trajectory of these substances. Alcohol has decreased and marijuana is going up. And one of the things that makes marijuana particularly scary for something for youth and being on the increase is that we know in young males, the increase of psychosis that marijuana use can bring on. And we're seeing more and more of this in our state, both on the adult side and particularly in the 18 to 25 age range, but in the 16 to 20 age range that we're looking at, it can be particularly damaging. We also know that it has an effect on cognitive functioning and school performance. So these are really important things that we have to wrestle with as a society in Oklahoma, in terms of what are we doing that is contributing to poor mental health in Oklahoma? What are we doing as a society? And what can we do to start moving the trajectory in a different way? This shows you what alcohol use amongst 6th, 8th, 10th, and 12th graders combined look like in a typical school year. You can see 30-day use, lifetime, about 40%, and binge drinking about 10. When I look at the 39%, what that shows me, and again, this is from 6th through 12th, that we kind of have a culture where it is socially acceptable among youth to try alcohol when you're young. And again, that's particularly important because what we know by data and statistic is that the later a person's first use of alcohol is, the less likely they are to have problems with abuse and addiction when they're an adult. So keeping alcohol out of the hands of youth is critically important. And a lot of that starts with conversations with parents about why it is important, about the risks associated with using alcohol. It's incredibly important. And you can kind of see here in the graph, and you can compare the United States to Oklahoma, which is what is important in these slides. We're not tremendously different in terms of Oklahoma compared to the US, but you can see in all categories, we are higher. And in some, we're considerably higher. So we have a culture as a state that alcohol use is okay. And then when we look at marijuana use, about 10% reports past 30-day use. And again, this is across 6th, 8th, 10th, and 12th. And lifetime is about 20%. But when you look at 10th graders in particular, you can see the increase in use and the increase in past 30-day use. So youth in Oklahoma are starting to perceive marijuana as much less risky, and they're starting to use it more. And then here's what I was talking about, the perception, because perception is incredibly important, is that the perception of whether using marijuana is risky or could have negative consequences, that perception continues to decrease. Youth are thinking, yeah, I know people tell me that, but it's just those adults talking. So we really have to learn to educate and have those conversations with youth in a way that they can incorporate that information. And we mentioned prescription drugs. And so we'll take a look a little bit around prescription drugs. We have pain relievers, sedatives, and stimulants, and what the use looks like across 6th, 8th, 10th, and 12th past 30 days. You can see that, fortunately, on pain relievers, we're seeing a decrease. On sedatives, it's holding close with a little bit of decrease, and stimulants as well. So those are good things in Oklahoma. And I will say, what do you think is probably the single biggest contributor to this decrease in Oklahoma on prescription drugs? I couldn't hear you. Access. If you'll remember, in Oklahoma, it was very easy to access these types of prescription drugs in the past. And there's been a lot of work done in Oklahoma, policy-wise, to make sure that that access becomes much more limited. Because if you're a youth, where are you most likely to get these prescription drugs? Out of the medicine cabinet at home. And so as we have less of this in the medicine cabinets at home, youth are less likely to have access to it. I told you I had a lot of statistics. I apologize if you're not a statistics person. Tobacco, you can see cigarette smoking is going down, which is fantastic. Smokeless tobacco in Oklahoma is high compared to the rest of the nation. We kind of have a culture that smokeless tobacco, it's a little bit macho and kind of okay. And we've really got to do some work there. And so we're staying at around 7%, which is more than double the rest of the nation's rates of use of smokeless tobacco. So now we'll talk a little bit about psychological distress. The tool that assesses psychological distress in this survey asks questions about, do you feel nervous? Do you feel hopeless? Do you feel restless or fidgety? Do you feel so depressed that nothing can cheer you up? Do you feel everything is an effort? And do you feel worthless? And then students respond on a scale of low, moderate, or high, indicating the level of psychological distress or potential need for mental health treatment. So we'll look a little bit about how that played out. So one thing that's great is 48% reported low. Again, I want to point out the positives. We really have to also spread the word about the positives, because that shifts perception and it shifts culture and it shifts societal norms. So, but there are many, many students that are reporting low psychological distress. However, if you combine moderate and high, we're at 58% of students expressing moderate or high psychological distress. So that's not good, and there's many things we can do about that. But what I would say is, if you have high psychological distress, then you really need high protective factors as a state. And then you can see these by grade, how that lays out. The higher the grade level, the higher the psychological distress reported. And you can see that in this graph, we're increasing. Now, we don't do the OP&A each year. We do it every other year. This that we're in now is a year that we'll be doing it, and all school systems will participate. It will be very interesting to see post-pandemic how this reports across the board with students in Oklahoma. And then you can look at it a little bit by gender. And one thing that's pretty staggering here is that girls or females are reporting much higher psychological distress across the grades than males are. We all have thoughts of what that could be, although I will say, you'll note that there was data and research that came out in the past year that said social media in particularly has a very negative effect, in particular on girls, how they perceive themselves, their confidence levels, and it actually correlated with depression and anxiety. And now you can look at psychological distress across grade, race, and ethnicity here on this chart. There's not huge variances in terms of ethnicity, but there is some that's noteworthy. So when you look at this, you can see 1 in 4 students, so 25%, reported that they were feeling hopeless. That means 3 out of 4 did not report they were feeling hopeless, but 1 in 4 is too many. 1 in 4 reported feeling worthless. And if we go back to what we just looked at gender and high psychological distress, it's likely that the ones feeling worthless and hopeless are females. 1 in 5 in terms of depression, that they didn't feel like anything could cheer them up. 1 in 3, everything is an effort. 1 in 3 felt nervous, and 1 in 3 felt restless or fidgety. So you can see this here across gender. And as you can see, as I was saying, feeling hopeless, feeling worthless, those are much higher in the female category. And restless or fidgety and nervous is dramatically higher in the female category. And then when we get down to suicide and thoughts of suicide, 1 in 5 seriously considered attempting suicide. 1 in 6 made a plan about how they would attempt suicide. And 1 in 10 had reports having an actual attempt. So if the number one reason that youth die by suicide is guns, and 1 in 10 report having an attempt, then there's a lot of access to means. Now, I would say that attempts and reported attempts most likely means they didn't have access to a gun. Because if they had access to a gun, that wouldn't be an attempt anymore. Because the most lethal way you can attempt suicide is with a gun. You are likely to succeed. If you take pills, if you attempt to hang yourself, you are much more likely to be having an attempt, which can flag an intervention and can change the trajectory of that youth. But if you have access to a gun, it's much more likely to be a completed suicide. I'm going to move forward a little bit more because I know I'm giving you a lot of information. But what I want to talk about now is, well, what can we do about these things? How can we make a difference? Well, let's talk about what are protective factors. Having a strong support system, a network of caring family or friends, or even support groups that can provide emotional support make a big difference in how you look on these risk scales and what kinds of outcomes you're going to have. And so I want all of you to think about that, whether you're a grandparent, an uncle, an aunt, whether you have a school near you that you can volunteer at when they have activities going on. All of those things make a difference. Having healthy relationships, maintaining positive and fulfilling relationships fosters a sense of well-being. It's incredibly important. Now, I say these things, this is true for all of us, right? All of these things make a difference in whether we're healthy mentally and honestly, whether we abuse substances. These things make a difference. But when we're talking about youth, it's critically important. Also, learning effective coping skills. And that's something that can easily be worked on at home. But of course, school systems can work on these as well. And probably should be just part of regular curriculum to teach youth about life, getting ready for life, how to handle challenges, is teaching healthy coping skills. Good communication skills, teaching youth how to communicate effectively is critically important. That is a protective factor. If you can communicate your thoughts and feelings to others, that is a huge protective factor. And then building, of course, a self-worth. What we do know is spending lots of time on social media does not build self-worth. It actually is the opposite. The types of things that build self-worth is trying a task and trying it until you can complete it. And those are little building blocks into building confidence and success. So things like sports, debate, art, music, all of those kinds of things are what fill a kid's confidence. So I want to look at what our youth are looking like in terms of protective factors. So this is for the school year 2019 and 20, and how kids scored on pro-social peer scale. So in 10th grade, we got up to 50%. But that's just at 50%. So we have a lot of work to do there for youth to have pro-social engagements. And this is something that the community and school systems can play a huge role in. What kinds of activities does your community have that youth can participate in that are pro-social? And then this is students who are categorized as high and protective for school rewards for pro-social involvement. So what is the school doing that is rewarding students when they have pro-social involvement? 10th graders got up to 53%, but the rest is way too low. So I throw these things out here as ways for all of us to be thinking about, what can we do as a state? What can we do as a society? As opposed to saying, wow, things are bad. You know, we know what to do, but we collectively as a society have to choose to invest in these things. And when I say invest, it doesn't even have to be financially. It helps for schools to have resources around pro-social activities, after-school activities, plays, all kinds of things. But these are the types of things that we have to learn to value as a society if we're truly going to value our youth and raise youth that have a positive outlook on tomorrow. I'm going to keep going forward. And there we have the end. I don't know if I have a few minutes for questions, but I hope that fed a little bit of, to get you thinking about youth in Oklahoma, where they're at today, what they're thinking, what their youth and their substance use and how they're feeling emotionally looks like today, and the things that we can do as a society and a culture to move that trajectory in the positive. So thank you very much.